My first.
My first time?
My first big exam.
My first surgery.
Oh yeah, that was crazy.
I didn't know if I would stay.
My first intubation.
My first real patient.
My first lumbar puncture.
My first suture.
Oh, yeah, my first cadaver.
I'm Faith Aeryn, and this is my first, well, it's my first podcast. I always thought I'd go into medicine. My hands are steady, I love math and science and solving puzzles, and I wanted to help people as a doctor. But that all changed when I met my first cadaver. I'm getting ahead of myself. Let me back up. My mom catches babies for a living, and a bunch of my aunts are nurses and physical therapists, so spending time in the hospital was a routine thing when I was growing up. In addition, my dad was a reporter, and I was a smart, inquisitive kid, so questions were definitely encouraged in our household. In grade school, I was in the Gifted and Talented Education program, which is an advanced or honors program, so instead of doing dissections in middle school like most people, I did mine in 4th grade. I was in year-round school, and it was a scorchingly hot summer day. Our science lab was in one of those portable buildings at my school, and the air conditioning was on full blast inside this frigid, formaldehyde-scented room. Enter big, brown cow eyeball. I come from centuries of dairy farmers on my dad's side. I knew this eye. Sweet, innocent, all too familiar. It reminded me of my friend Bessie the cow back in New Jersey, and there was no way I could cut it open. I was horrified and lightheaded, and I have to tell you, it didn't get any better when the pig's fetus showed up. Revulsion eclipsed curiosity, and all dreams of doctorhood just disappeared. Goodbye, future Dr. Me. I mean, seriously, if I couldn't handle dissecting livestock, how could I ever cut open a dead person, much less a live one? So here I am, many years later, still fascinated by medicine, and while I couldn't wield the scalpel as a kid, I can cozy up with this awesome microphone and talk to med students and residents and MDs to better understand the medical and med school world. Now, please excuse me as I live a bit vicariously and work through the mental roadblock that stopped my brilliant career before it even began. As a med student, your gross anatomy lab, cadavers included, begins in your first semester, sometimes even on the first day of med school. So in my conversations with medical professionals and med students, my first question was, do you remember your first cadaver?
Yeah, I do remember our first cadaver.
That's Dr. Daniel Maselli, a recent graduate at the University of Massachusetts Medical School.
We had been at school for about 2 months, and we were provided with a cadaver, which is just remarkable and strange and beautiful in a lot of ways that someone would give their bodies up for the sake of a medical student's education. It was very anxiety producing because there's this question that you ask yourself throughout medical school. Am I worthy? There is any number of things that people are doing on your behalf, tremendous sacrifices that people are making. And you kind of question yourself all along, saying, am I worthy of this? Am I worthy of this? And this anatomy lab is part and parcel of that uncertainty, of that doubt, because, it's a tremendous gift, a tremendous sacrifice in a lot of ways. So there was this tremendous amount of, am I going to make the most of this situation? Am I going to justify this gift that someone has given us? Then there's just the obvious anxiety of, we are dissecting a human being. That is nothing like I had ever experienced before. You dissect any number of things in your prerequisite pre-med classes. I think the largest I had ever gotten up to was a frog. I know some people had done pigs or cats, but I think frog, I never even made it out of the reptile phylum there.
The second he said reptiles, it jolted me back to one of my least favorite smells, formaldehyde. So, of course, I asked.
the smell, it's funny that you bring that up. That is probably one of the most memorable things. Formaldehyde has a very distinct smell, and it permeates the entire basement level that the UMass Anatomy Lab exists in. But the nice thing about formaldehyde, sort of metaphorically, is that it physically preserves protein, but it also was a very nice preservative in terms of forming this tangible memory and experience for us, because the anatomy lab is something that we carry, with us for the rest of our experience. There is something we carry with us for the rest of our experience in med school and beyond, I'm sure. I still get flashbacks to anatomy lab whenever there is a smell that is similar to formaldehyde. Fortunately, there aren't that many of them. Formaldehyde that's just a thing that sticks with you physically too. Like, it really sticks with you after you've left the lab and you have to shower for a couple times to get that smell out.
I can't imagine. You guys must be able to tell, like, if you're dating someone at the time and you're like, oh man, you just came from the lab, didn't you?
Yep, definitely. It would be nice, though, if they had bothered to change out their scrubs. If they had done that, then you're like, okay, you at least put in an effort.
We'll come back to Dan in a moment. When he said scrubs, he actually reminded me of another interview I had with Dr. Christopher Showers, who went to Columbia.
The way that we did it at Columbia, it was on the 10th floor of this old building. What used to be the hospital, but then they moved the hospital to Milstein, which is much nicer. And it's this old Presbyterian hospital building, which is no longer a clinic. It's just kind of labs and office space. And the 10th floor, they've got this huge cadaver lab, right? And so it's the first time I wore scrubs. I'd never worn scrubs before. And they give us these scrubs because it's the first day of anatomy lab. And I'm like, oh, geez, look at me in the mirror of the bathroom. I'm like, oh my God, I got scrubs on. Somebody take a picture, And we're all just clustered around the door, loitering, and nobody knows what to expect. Maybe some of them had seen a cadaver before. I certainly hadn't. And everyone's just trying to play it cool, but we're all so kind of jittery and like, holy crap, we're about to see a dead body. And then we have to do something with it. And then they open the doors, and we all kind of pretend not to rush in, but I suppose if you were to look at it on like a surveillance camera, you'd be like, man, those guys really rushed in there. And the smell in the anatomy lab is just something you'll never forget. But we get over the body. There's 4 of us. And there's a sheet over it, and we're not supposed to take the sheet off yet. So we're all just kind of looking at each other, and it's just this, like, 2 seconds felt like a year because we all just want to look at this thing, and we're all so nervous. And a girl in that group, incredibly close friend, we always talk about our friendship being formed kind of over that cadaver. There was a real moment there. We were like, I don't know what I'm doing. And she was kind of like, I have no idea what we're about to do.
Our cadaver was an 81-year-old gentleman. And we called him Adam because he was missing a rib on one side. And so we thought that would be a pretty clever reference to Adam from the Bible.
What I wanted to know next, though, was where they even began with the dissection.
The first incision we made was on the very first day, kind of innocent, benign first lab. It was the muscles of the back. So the cadaver was face down. Not a lot of identifiable features of that would be unique to identifying the person, like the hands and the face that are so just so human. It was just a back, very almost two-dimensional. And nevertheless, that first incision was just, you're shaking. We can't do any harm to this cadaver, obviously, but there was that element of respect. Like, I want to respect this cadaver.
I remember the cadavers. That didn't strike me anyway. They don't really seem like people.
That's Dr. Emma Husain. She went into orthopedic surgery after graduating from McGill University in Canada.
One of the reasons for that is that you begin dissection on the back. You do the trapezius, the traps. So you don't see a face or hands, which are the most human parts, right? Surgery is the same way. We drape the patient for sterile purposes, but then ultimately what you have is a little strip of skin and a hole, and you go in and dig around and do some stuff. It's not really a person until you see their hands or their face, and I've always noticed that. So it was turning the body over, which happened much later, where there was a little moment of, oh, you know, because this person has really straight teeth or a big nose or really nice thick hair, or, you know, things that made them human to me. On that topic, I think the time that hands, just remembering hands, was really upsetting was when I was in surgery in Montreal. It was an orthopedic surgery rotation, and a 16-year-old girl got hit by a car, and she had multiple liver lacerations, a head injury, crushed chest. She was a pedestrian, so it was really bad. And they were trying to operate on her and stop there were so many problems with multiple surgeons, and we were kind of standing by as ortho to deal with any fractures later. And she died. And I remember her hands because she had pink nail polish on because she was a young girl. And, you know, again, sometimes there's a line between you and the person on the table, and sometimes that line just blows away. And it was, I'll never forget the little hand of a little girl, hasn't even finished growing, and this chipped pink nail polish on these not very well filed nails, you know, real typical little girl hand. And that really struck me. So I think it's easy to dehumanize patients, but for some reason, seeing their hands, I guess I'm also in a surgical context where they're not talking or anything. Seeing their hands has always reminded me of how this is a precious human life that I'm looking at, and not a job that will keep me up till 2 because I'm on call, you know.
Something that really resonated with me was a thing that a chancellor had said to us on our arrival to medical school and before we had gone down into labs, is this is your first patient, you know, as your first patient as a medical student. And obviously they weren't alive, but in a lot of ways you wanted to take just as much care of them and respect them and the integrity of that partnership. Because much like the patients that we would then have for the years to come, that is how we learn. We learn best from our patients.
And as much as medical students and professionals learn from their patients, they, and we in general as human beings, can also learn from each other. Much more than the technical stuff, more than right answer, wrong answer, this is how you suture. They can learn how to navigate the sea of complex, swirling emotions that we all experience along our paths. Feeling mediocre at best, coping with intense amounts of pressure, and staying human through it all. There's value in this, in the sharing, in the listening and absorbing. And by hearing these true, very personal experiences of vulnerability or anticipation, fear and doubt, happiness and heartbreak, told as a memory from a distance, on the other side of graduation or residency and achievement, we can honor the beginning of the journey. We can see it for what it really is, a start. Because, after all, everybody's got to start somewhere. Thank you to Doctors Daniel Maselli, Christopher Showers, and Emma Husain, the My First Cadaver team, Mom, Dad, my mama, Neil Brown and Wilton Young, Alicia Marcano, Jacqueline Jackman, Lucy Lunsford, Allie Smith, Neri Laura, and Christopher Luggiero, Papa Claire Music and Compulsion Music, our nerf-blasting friends at Salted Stone, and special thanks to Robert Meekins, who is not a doctor. Stay tuned for episode 2. We've got some awesome, awkward patient encounters to share, coming soon to a listening device near you. And remember, guys, Don't take a selfie with a bear, or you could become someone's first cadaver.
And then the other thing I'll say, and I don't know if this is appropriate for the podcast or not, but our cadaver was it was a male. He was incredibly well endowed. And it was like some sort of bizarre joke, but people would come from around the lab and be like, oh my gosh, like you guys have a particularly healthy man there. And it became kind of a running joke that we had like won the cadaver lottery for that reason, but not that it really furthered our education or anything.
This episode of My First Cadaver was sponsored by Med School Tutors. Med School Tutors has the talent, resources, and experience to personally prepare potential heroes for one of the most important tests of their lives. Let Med School Tutors be a part of your origin story. Together, we can save the world.